Doctor, you gave us a fantastic overview of perimenopause. Tell us about menopause, exactly what you see a woman go through, what she is potentially going to go through, and what she may or may not go through.
So if you look at menopause, it's that one day, 12 months after a woman's final menstrual period. So let's say she's been through that. So she's definitely going to experience no period. So that becomes like the classical first symptom. I have no period. If she's already gone through perimenopause and menopause, and after menopause, a woman is in post-menopause. So that's the first thing. But then comes, what's going on with her body. So the classical symptom is the hot flash, which is the body's way of not regulating body temperature. So it's very susceptible to changes in temperature on the outside. So it's suddenly a woman will classically say, I am experiencing a wave of heat that starts from underneath and then creeps up on my skin, and then I either, I get completely flushed. So there's like redness, and then some women will break into a sweat. Now that is a classical hot flash. Basically, your body is trying to cool off at that time, so it's vasodilating, and break out into a sweat. Now that happens, it can happen sitting in an air-conditioned room, and that is the classical sign that basically everyone else is okay and you were comfortable 5 seconds ago, and now suddenly you've broken out into a sweat. In the daytime, most women will learn to manage it because, change your clothes or shower or carry an extra set of clothes to work. But at night, which are called night sweats, is when is traumatic, because then you're waking up so many times at night. There's sheets on, sheets off, AC on, AC off. Then there is, if you're with a partner or with a husband, then there's an entire disharmony of what's going to happen in the bedroom with temperature. So that becomes a big sleep disruptor. Now, earlier, what used to happen was most women would say, it's a hot flash, it's a night sweat, I'll get over it. It's not a big deal, it'll pass. And it does. It does get milder as time passes. So women, 80-90% will complain of hot flashes. Now, over time, we've seen that they can last for as long as 10 years.
Goodness.
And for some, they get milder. And then there will be around 10 to 15% of women, even over the age of 70, who will continue to get hot flashes. But we are women, we figure it out. So we don't really, it's a hot flash, TK, what's the big deal? Question is, what else is going on in your body at that time? And I think like that is, if you're getting a hot flash, then look into what else is going on. That's the time that a lot of things, including your heart, your bone, are also undergoing change. And even if you look at just the hot flash, let's say I don't want to look at the rest of my body. If I look at a hot flash, today we have research that says women who have moderate to severe hot flashes have a higher cardiovascular risk, have a higher risk of stroke. It's not that the hot flash causes it, but there is a mechanism that's going on inside that's creating that hot flash, which is also damaging your heart or your blood vessels, and that's increasing your risk of heart attacks and stroke. So I think that is important, that look deeper. It's just not skin deep. And the second part, woman who's not sleeping, what is going on next morning with her? Right? Let's just start with brain fog, exhaustion, lethargy. That means she's not going to the gym, she's not moving, and she's got cravings now because she's not slept well. So she's going to eat this sugary stuff the next day. Her cholesterol will go haywire. Her tendency to get diabetes will go up because she's not moving and she's eating all of this rubbish. There is, low productivity at work, less joy, less happiness, and relationships don't survive it. So basically, the consequence of the hot flash is so huge. It is not just, it's just a hot. That attitude is just a hot flash, but not looking at what it's doing to you systemically. That's something that, we're always struggling with. That, look at what else is going on.